Hello, I am Amir Ali, a Master of Health Policy and Management. Today, we will discuss about the health system. What is healthcare system? A healthcare system consists of all organizations, people, and action whose primary intent is to promote, restore, or maintain health. It includes formal systems such as hospitals, clinics, health professionals, insurance, as well as informal systems like traditional healers. The primary components of a healthcare system include service delivery, health workforce, information system, access to essential medicines and technologies, health system financing and risk pooling, governance, accountability, and leadership. We will discuss all of these in later slides. So, what's the difference between health system and healthcare system? Health system generally refers to the broader organization of people, institutions, and resources that deliver health services to population, including public health initiatives and preventive care. While healthcare system typically focuses on delivery of medical care, including hospitals, clinics, and other clinical services. Why we are comparing global health systems? Comparative analysis of healthcare system enables policy makers and health professionals to identify best practice and innovative models from high performing countries to address inefficiencies, resource wastage, and service delivery gaps to develop equitable health reforms tailored to specific socio-economic contexts and to understand the impact of different health systems on life expectancy, disease burden, and financial protection. Example countries like Japan have achieved better health outcome at lower cost, offering insights for others. This is the report by World Health Organization, the World Health Report, which focuses on improving the health of population through effective health interventions, enhancing responsiveness, ensuring financial protection by reducing the financial risk associated with ill health, equity in health and access, by ensuring all individuals can have access to health services regardless of their socio-economic status. So this is the side, overall function of the health system, which overlooks delivery services, example provision of the services, creating resources. It directly affects and has impact on finances, including collecting, pooling, and purchasing, which impact the resource creation and delivery services that ultimately has impact on health. While health system also has impact on non-medical expectations and responsiveness, and it has to be fair. These all are interlinked and affect each other, where ultimate objective is to obtain and achieve optimal health of the population. This is the World Health Organization system framework. It has six pillars starting from service delivery, health workforce, information, medical products, vaccines and technologies, financing, leadership and governance. The overall goal of this six system block of World Health Organization is to improve health, responsiveness, social and financial risk protection, and improve efficiency by providing access, improving coverage, providing quality of health services, and safety of health services. WHO building blocks of health system. World Health Organization identifies six core building blocks. that make up a health system. Number one includes service delivery, which ensures comprehensive, accessible, and quality services, health workforce that ensures sufficient number, distribution, and skill mix, health information system to provide accurate and timely data for decision making, medical products and technologies to ensure availability of safe and cost effective tools, health financing, adequate funding to provide adequate funding with financial risk protection, leadership and governance to provide transparent and accountable institutions. The first pillar of the WHO building block is service delivery. It refers to the provision of effective, safe, quality, personal and non-personal health intervention to those in need. It is how health inputs are combined and organized to produce and deliver health services. The key characteristics of World Health Organization align with service delivery is to achieve optimal health outcome. Service delivery within this framework should embody the following. Number one, accessibility. Services are physically, financially, and culturally accessible to all, with primary care as the routine point of entry. Number two is the quality. Services are effective, safe, patient centered, and delivered in a timely fashion. It has to be person centered. Services are organized around the needs of individual, which fostering the participant responsiveness to their preferences. Availability and readiness. Healthcare facilities are present adequately equipped and staffed to provide the necessary health services. Continuity of care, seamless and coordinated care across different levels of health system for health conditions and throughout the individual's life cycle. The second important pillar is the health workforce. It comprises all the people engaged in action whose primary intent is to enhance health. This includes doctors, nurses, allied health professionals, community health workers, managers, and support staff. The key aspects include availability, ensuring a sufficient number of health workers to meet the population needs. It health workforce has to be competent, possessing the necessary knowledge, skills, and attitude to deliver quality care. Distribution, equitable geographical distribution of health workers, especially in underserved areas. Motivation and retention, creating an environment that supports, motivate, and retain health workers, including fair remuneration, safe working conditions, and opportunities for professional development. And last is the productivity. By optimizing the efficiency and effectiveness of health workforce. The third important pillar is the health information system, a system that integrates data collection, processing, reporting, and use of health information to improve health system effectiveness and management. It provides the evidence base for decision making. The key areas include data generation, collecting reliable and timely data from various sources, example routine health facility, survey and vital statistics. Number second is the data analysis, processing and analyzing data to generate meaningful information and insights, data dissemination and use, ensuring information is available to the right people at the right time for planning, monitoring, and evaluation. Data quality, ensuring accuracy, completeness, timeliness, and consistency of the data. Information technology, utilizing appropriate technologies for the data management and sharing. The fourth important pillar is the access to essential medicine, which ensure equitable access to quality assured, safe, effective, and affordable essential medicines, vaccines, and technologies. This includes their selection, procurement, distribution, and rational use. Key aspects include identifying and prioritizing essential medicine based on health needs and cost effectiveness, the procurement of the medicine, supply chain management, which ensure effective storage, distribution, and inventory management, quality assurance, ensuring the safety, efficacy, and quality of all medical products, promoting appropriate prescribing, dispensing, and patient adherence to the medicine. Number fifth is the financing. The function of health system that deals with how funds are generated, pooled, and allocated to provide health services. It aims to ensure that people can access needed health services without financial hardship. Key aspects include revenue collection, mechanism of raising fund, taxation, social health insurance, out-of-pocket payment, risk pooling, spreading financial risk across a larger population of to protect individuals from catastrophic health expenditure, purchasing and allocation, strategic allocation of the pooled funds to different health services and to maximize the health gain and efficiency, equity in finance, to ensure that the contributions are based on ability to pay and access to the health services based on need, efficiency is to maximize the value for money in health spending. The last pillar is the leadership and governance. The function of health system that deals with how funds are generated, pooled, allocated to provide health services. It aims to ensure that people can access health needs services without suffering from financial hardship. Key aspects include policy and planning, regulation, oversight and accountability, partnership and collaboration, information and intelligence, and stewardship. Policy and planning. By developing clear national health policies, strategies, and plans. By regulation is through establishing and enforcing regulations to ensure quality, safety, and ethical practice, oversight and accountability. Oversight and accountability by monitoring performance, ensuring transparency, and holding stakeholders accountable. By partnership and collaboration means through fostering collaboration among various stakeholders, example public and private sectors, civil societies, and communities. Information and intelligence using data and evidence to inform the governance and decision making. Stewardship, the overall responsibility of the governments to protect and promote the health of population. Now the another important concept is the universal health coverage. It ensures that all people have access to health services they need without financial hardship. UHC index is calculated by the coverage of essential services plus financial risk protection. It measures the progress which varies across countries with high income countries closer to achieving UHC. It has three important components. Number one is the extent of the coverage to reduce out of pocket fees and cost sharing and including new services. And this is the pool of the funds which used to measure the universal health coverage. So the pandemic impacts on health system. For example, during COVID-19, the health system exposed to vulnerabilities and forced system adaptations, which responds by increasing search by this increasing capacity building. Digital health was accelerated during that time. Example, vaccine rollouts and the urgent need for vaccines and the health data. The lesson which we learn is the need for resilience and investment in the primary health care. Future trends in global health system. The emerging trend include personalized and precision medicine, integrated care model, artificial intelligence, and community-based health promotions. While sustainability and equity remains the core values. Conclusion and key takeaway. Global health systems vary widely, but all aim for improved health, equity, and financial protection. Key action required to strengthen primary healthcare services, ensure the achievement of universal health coverage, and to invest in health workforce and innovation. With global cooperation, which is essential for resilient and inclusive health. So let's recap. Which of the following is the goal of health system according to World Health Organization Health Report of year 2000? A. Maximize private healthcare. B. Ensure financial protection. C. Promote out-of-pocket models. Or D. Minimize service delivery. So the answer is B. To ensure the financial protection. So the next question is, what is the function of health financing in a health system? A. Delivering care directly, collecting and pooling resources to fund services, regulating providers, or D. Licensing medical products. The correct answer is B. Collecting and pooling resources to fund services, as it is directly related to the health financing. This is the reference reading for the World Health Report year 2000.